pharmaceutical and medical services and his staff who are based at the Ministry Head Office, the Central Division, Eastern Division, and CWM Hospital. We thank you most graciously, sir, for giving us this opportunity, leaving behind the busy schedule of your High Office to grace with us your presence this morning and to share with us your vision and plans and our champion in the fight against NCD.
I'm so glad and deeply honored to be here with you this morning. This will be my second meeting with the senior officials and members of the Ministry of Health and Medical Services. Last week, on Thursday, I had the pleasure of meeting with the Minister, the Honorable Samate, and the senior executives of the Ministry at your headquarters. And later on this week, on Thursday, I will be meeting the officials and students of the medical school and the nursing schools at New York and Taiwan. I look forward to that too. I'd ask for these meetings, firstly, to thank the Honourable Minister for inviting me to be Fiji's champion and lead advocate in our national campaign to eliminate or try and combat and control non-communicable diseases, NCDs, as you all know. In accepting this honorary role, I also wanted to appeal to the entire Ministry of Health and Medical Services for us to work together to achieve our collective goal of trying to eliminate NCDs. As medical professionals and workers within the ministry, you are all undoubtedly aware of Fiji's status concerning NCDs. The Honourable Minister has been reminding our beloved nation that NCDs contribute to about 80% of deaths below the age of 70 years. This is confirmed by the World Health Organization, which reports that Fiji has the second highest rate of NCD-related deaths in the Pacific. Essentially, this means that Fijians are dying young, and the main cause of NCDs. Not good news. And if that is not enough, we're now in an era, and we hear that Fiji is ranked as the second highest nation in the world with deaths caused by diabetes. A few weeks ago, I attended a food care symposium organized by the Fiji Diabetes Association in conjunction with the Ministry and the World Diabetes Association. I learned that diabetes is perhaps Fiji's top killer now within the long list of NCDs. I also learned that more Fijians are losing 2 lower limbs per day due to amputations because of diabetes. And 2 weeks ago, I had the pleasure of meeting Dr. John Hawea, who briefed me about his work as a surgeon in trying to deal with people with diabetes. It's very sad to listen to this account of what had happened in this country. The report on Fiji's health status for the past 50 years shows an increasing trend in diabetes, high blood pressure, and obesity. At the recent NCD summit in Tonga, I believe the Honourable Minister was there, the World Bank estimated that the economic burden on NCDs in Fiji, if business as usual continues, would be about US $213.58 million by 2030. This is projected to increase to about US $342.737 million by 2040. We're talking just a few years from now. That's a lot of money for our little economy. Not good. The World Bank noted that the biggest driver of lost output or outcome is the potential loss of labor due to early deaths from NCDs. It says the potential loss of effective labor force by 2040 in Fiji will be about 16.4%. Heart disease will contribute about 60% of this burden, and diabetes 24%. Cancer 8%, and lung disease 7%. As professionals, I'm sure you're all aware of these things. Well, the World Health Organization and the United Nations Development Program are currently doing a more comprehensive research and evaluation of how NCDs are affecting social and economic developments in Fiji. And as the lead advocate in our work against the prevalence of NCDs, I am ready to know the final outcome of such research and work. All these statistics are alarming. We will all agree that Fiji's status on NCDs is extremely unfavorable. They not only project a very poor image of our nation, but they importantly reflect a trend of very bad decision making on the part of all of us. Some might say that these circumstances are byproducts of development, especially in developing countries, as they try to improve their social and economic status. However, we cannot and must not accept this, because even as a developing country, we are a progressive nation that is beginning to take leadership positions within the international society of states, and we are also placing significant emphasis on educating our people to be responsible and productive citizens by changing mindsets and, more importantly, making the right choices. This is reflected in government's budgetary allocation, where education has consistently received the highest budget within the social services sector. Ladies and gentlemen, as a soldier, I believe in keeping fit and leading a healthy lifestyle, so please allow me to digress a bit. A large component of a soldier's training and actual work is focused on maintaining peace and stability at home, and if need be, in war-torn countries, as our people are doing in the Middle East and other conflict zones around the world. Soldiers learn to conduct security assessments, among other things. They learn to detect threats and potential threat situations and deal with them decisively. Dealing decisively with threats and potential threats includes not beating around the bush, but addressing the core issues. We should all realize that NCDs are a threat to our nation. Like it or not, it is a threat. NCDs are not a perceived threat. In fact, I see NCDs as a scourge to our nation. They are a threat to all our people, irrespective of age or ethnicity. They are a threat to our potential and capability to progress and prosper, socially and economically. They are a threat to our children and the future of our nation. NCDs are a real and present threat, and we must deal with them decisively. I'm aware that the Honourable Minister of Health and the Assistant Minister are doing all they can by educating the public, considering facilitative legislations, and repositioning the entire health sector to deal with NCDs among the other national health concerns. I'm also aware that many of you are trying your best to help the Honourable Minister, especially to render your technical expertise and interventions in the clinical management of NCDs and their resultant complications. I acknowledge and thank you for your commitment and tireless efforts. However, you'll agree that our health statistics strongly suggest that we need to do more now. Therefore, I'm also here this morning in my capacity as President Head of State and in my official capacity as Swedish champion in the fight against NCDs to reconfirm my support for you so that we can decisively deal with NCDs. Together as a united team, let's help our nation. Our end state and desired outcome must be to have a healthy, productive, prosperous, sustainable, and happy nation. To achieve this, our quest must be to eliminate NCDs and to promote wellness. I take pride in wearing this wellness pin, which the Minister gave me some months back. We need to properly identify the root causes of NCDs. I appreciate the advice from our National Health Advisor on NCDs, Dr. Ismail Tukana, that NCDs are caused by smoking, nutrition or the lack of it, alcohol and physical inactivity. The acronym is STEP. I'm sure you're familiar with it. Having identified the root causes, we must make haste in identifying all the opportunities, which I suppose will of course be multifaceted in nature. We need to educate our people. We need to consider various forms of legislation that will help our nation's cause, and more importantly, we need to walk the talk. Big ask. I want to help especially with the walking of the talk aspect. And I believe that it is very important that we start right here, right now, within the Ministry of Health and Medical Services, and with the staff and members of Fiji's Head of State's household. For your information, ladies and gentlemen, as a soldier in the command, I believe in leading by example. I have instituted a very strict diet and physical training regime for my staff. And we try our best to do our 5 kilometers every morning, and by Friday at the end of the week we try and do a 10K. With my age, I'm finding it hard to keep up with my young members of the staff. I can only try. We're trying to lead by example, keeping fit. I appeal to you, all of us, to lead by example, please. I cannot imagine encouraging the public to make the right dietary choices and exercise daily if you and I don't do it ourselves. It's going to suffer us. Similarly, our people will not heed our advice if the medical personnel and all those who work in the health sector and in leadership positions throughout the country do not eat healthy meals and exercise daily. Every time I listen to the Honourable Minister plead with the parliamentarians in Parliament and the rest of the community, I know exactly what he's talking about. We have all my support. Let us look first at our own status. Are we healthy? Are we physically fit? Are we mentally, spiritually, and intellectually sound in mind and body to lead and be role models for our team? Or do we still prefer to be complacent and continue to lead a sedentary lifestyle as senior officials and administrators, which in my humble opinion is at variance with the government's vision of a healthy and prosperous Fiji? Ladies and gentlemen, I would like to recommend a few pointers for your consideration, and these results from my discussions with Dr. Tukana, who told me that we should all quit smoking and declare all our workplaces tobacco-free. I'm glad the government has instituted the law to help in that regard. We should not allow unhealthy foods and drinks to be served, eaten or sold in Ministry of Health and Medical Services facilities. I know you've got a canteen. I don't know what you're serving there. I think this is what Dr. Tukana is talking about. We should be responsible in our drinking of alcohol and moderation. We should exercise daily and promote physical activity in our workplaces. And last but not least, we should make every effort to reduce obesity in the workforce. Ladies and gentlemen, I know that as learned health professionals, you can add to the list on how we could and should deal with NCDs because it's a threat to our nation. I look forward to learning of the proposed approaches and strategies that you may have planned so that I could help promote them in my engagements with our community. The reality of the present situation is that we have identified this problem and must accept the fact that we have a significant amount of work to do, and the work starts right here with us, right now. So please let us lead by example. I thank you again for the opportunity to be here this morning. May Almighty God continue to bless you all in your work and bless our beloved nation Fiji, Mawalewu, Dhanyawad. Thank you. God bless.
Thank you,